I'm here with Dr. Andy Tao from Austin Gastroenterology. First of all, doctor, thank you so much for being here.
It's my pleasure.
All right, so some pretty exciting news. We're talking about a new Shield blood test for colorectal cancer screening in adults ages 45 and older, just approved this week by the FDA. First of all, how effective is that blood test at identifying colon cancer?
It has a sensitivity of about 83%, which is not as good as colonoscopy and not as good as even some of the stool-based tests, but it has the benefit of being easy to obtain. It's just simply a blood draw, which has never been able to be developed before. So this is kind of a first of its class type of detection system. What does 83% really mean? That means if you take 100 people with colon cancer and you say, we're gonna give you this test, how many of them will this test ping positive for? 83%. That means 17 out of 100 people will be told if they have this test that they're actually okay when in fact they have cancer. Now, that may seem disconcerting to some people, but there are guidelines that the government says are acceptable, and this has met that regard. Yeah.
And it's basically just a blood draw.
That's right.
And then it's taken after that. But you mentioned, you alluded to this a minute ago, colonoscopy is still the gold standard for colon cancer prevention, right?
That's right. And the key word that you mentioned there is prevention. It's very important to understand that the colonoscopy prevents colon cancer, whereas the Shield test and other stool-based tests, they are for early detection of cancer when it has arrived in your body. Okay. Now, it's still important to capture that event when it happens, but a colonoscopy is able to prevent the cancer from happening. And why? Why can a colonoscopy prevent it? Well, it's because colon cancer, unlike all other major cancers, has an intermediate phase called a polyp. And during the colonoscopy, you can shave off all those polyps, essentially resetting your colon's basic risk for getting colon cancer. You can basically reset that. These other tests do not do that. They do something important, which is they detect early stage 1, stage 2 colon cancer when it arrives, but they don't prevent it.
And doctor, we were talking a minute ago about just how common these types of cancers are becoming. So I want to ask you to close things out, who should be screened, when, and how often?
Colon cancer is the second leading cause of colon cancer death in the United States. Unfortunately, it's becoming a disease of younger and younger people. Why that is a billion-dollar question. You and I will be the first generation whose lifetime risk for colon cancer will be greater than our parents. And there's some type of exposure that's happening to us that's causing that. It's not just in the Western Hemisphere, but it's more and more frequent. And that's why there's a big push for these types of tests. Who should be screened? Anyone who is age 45 should start screening, so long as they don't have a family history of colon cancer or significant polyps. If you have family history for colon cancer or significant polyps, you start at the age of 40 or 10 years before the diagnosis of your first degree relative. And so definitely I encourage all people to really take control of your health. And if you have a family history of colon cancer, you should call us. And if you want really the single best test, colonoscopy is still the best test. But if you're resistant about that, well, there's a saying that says, the best test for screening is the one that gets done. So you have to kind of make a judgment between a stool test, these new blood-based tests, or the gold standard, which is colonoscopy.
Yeah, not something a lot of people want to think about, but so important, especially given those cancer rates. Dr. Tao, thank you so much for being here. Really appreciate your time.
Thank you.